Substance. So, what do we understand by the word substance? Substance can be anything. It can be the food that we eat, the water that we drink, the materials around us. But when we talk about substance abuse, particularly a few things come to mind. We think of tobacco, we think of alcohol, and then we think of drugs. Now, substance abuse, what is the word abuse? Abuse is anything which you do over the limit, or anything which is not to be done but you do it. We get from that substance abuse. And then now cancer. How are they related? Now I will just speak a short thing on that substance abuse and cancer. Now when we think of substance, we think of, again, tobacco. So that's the first thing which comes to mind. Tobacco, alcohol, and drugs. So if we look at the research, if we look at the statistics, if we look at all the papers, tobacco is the leading cause of cancer worldwide. 40 to 50% of all cancers is caused by tobacco. Tobacco can be smoked, like we smoke cigarettes, cigar, biri. It can be chewed, like commonly available gutka, shikar, rajni, talak, pan, betel nut, all these things. Now, think of the number, 50%. Just imagine, if we are able to eliminate this tobacco by magic or by whatever means, then automatically 50% of the cancers which are currently happening in the world, which is going to happen in the future, will automatically disappear. Now, when we talk about the abuse, we know, like, even with tobacco, even a small amount is an abuse. There's like no limit. You can start with one cigarette, you can start with one pan, but that is also abuse because tobacco itself is not beneficial to the body. And talking about the numbers, if we look at India, head and neck cancer, which will include the mouth cancer, the tongue cancer, and throat cancer, and all those things, it is one of the top common cancers in India. Why? Because us Indians, we have the particular habit of chew tobacco. We chew a lot of gutka and pan and all. That's why proportionately we also have a higher rate of head and neck cancer. If we come to Nagaland, we see, like, even I work in Eden Hospital, I'm an oncologist there, and then we see a lot of young patients coming with ulcers in their tongue, ulcers in their mouth, difficulty in swallowing, and they all invariably give an history of chewed tobacco or tobacco intake. So there's no denying the fact that tobacco will lead to cancer. And if we think of alcohol, again, alcohol and tobacco, they are like brothers, they are like lovers. If you start with one, the other one is sure to come. So the combination of both, if you, statistics shows that if you chew tobacco, you are at a 50 times more chance of getting cancer than someone who doesn't chew tobacco. On top of that, if you add alcohol, if you add smoking, then it increases even exponentially. So all these factors will combine to form cancer. Now, if we see to the next person, you might say, this guy has been smoking for the past 30 years, 14 years, nothing has happened to them. But cancer does not form in one day, it does not form in a few months. It usually takes multiple years, but eventually, if you continue to abuse tobacco, cancer will form. So, in some people, it may form earlier, in some people, it may form after decades, but eventually it will form. Even for those who have been smoking for so long and then they don't have cancer, the thing is, like, if you smoke, if you drink, in general, your health will be affected, whether it's because of high BP, liver failure, kidney failure, all those things. So they don't reach an age where cancer can form. They are already dead by the time cancer was about to form. So again, for the deniers, tobacco will lead to cancer. Drinking too much of alcohol will also lead to cancer. Now, again, coming back to tobacco, we get reviews from outside of India, and they say, like, they get a lot of liver cancer patients from Nagaland. Disproportionately high. We are just 20 lakh population, but our liver cancer rates are very high. Why is that? Because we are abusing alcohol, we have very high rates of hepatitis infection, so all these things will contribute to the liver cancer. And again, when it comes to, tobacco, smoking, if you think about smoking, 80% of all lung cancers is caused by smoking. That is a fact. And then smoking and lung cancer is one of the most dreaded diseases, dreaded cancers. It's very difficult to treat. And then the third thing which I mentioned is the drugs. Now again, us Nagas, our Naga society is facing an epidemic of drug usage. We all must have heard about the sunflower drug. We have heard about the IV drugs, the heroines, the cocaines. All these things are so prevalent. Now, drugs directly will not lead to cancer, but the drugs will destroy your body. It will destroy your mind, and it will open up the gates for the factors of cancer-causing factors to enter your body, and then eventually it will lead to cancer. Again, if you are especially abusing IV drugs, you are more prone for HIV, you are more prone for hepatitis, and all these infections make it easier to form cancer in the body. So that are some facts which are in the literature. Another thing, in our society, what we see now, what as a practicing doctor, as a practicing oncologist, we see in our hospital is the age of the patient is slowly reducing. Previously, cancer commonly was a disease of old age, about 50, 60 years, 70 years. But now, younger patients, younger people are coming, seeking treatment with cancer. Why is that? Because our lifestyles have changed, and then the things that we do have changed. Most of the youngsters now, including us, we live a more sedentary life. We are more indoors. We are more with our phones. We do not have much physical activity. At the same time, we are taking in so much of cancer-causing agents. Even the food that we eat a lot of fast food. We eat a lot of fried food. We eat a lot of chili. We eat a lot of meat. So all these things, these are also abuse, can lead to cancer. On top of that, everywhere now, tobacco abuse is going on, especially with the chewed tobacco, like shikar, with rajnikanda, with talab, all these things, and then pan. So even now, the number of young patients are increasing, and it is projected, and then I believe that in the next maybe 1 or 2 decades, the number is going to increase even more, because every other person, especially below the age of 30 years, in their 20s, are all abusing some form of tobacco. So that is the reality. And then another thing which I would like to say is prevention is better. That's something which we all know, but we should put into practice. And especially when it comes to substance abuse, like our society, we are very strict against drugs. If you see someone or if you hear about some drug addict, and our society is very critical towards that. When it comes to alcohol, again, we are known as a dry state, but we all know the reality. The ground reality is that we get alcohol freely. Anyone who wants to drink, from an unemployed person to the most richest person, they are able to get alcohol. So, and even the alcohol that we get, many times they are adulterated. So that is again leading to faster liver damage, faster cancer formation. So if we look at these two, especially in regards to alcohol, the laws, the NLTP, all these things, even though it's in place, it is not able to prevent the alcohol abuse. There are so many alcoholics in Nagaland. So law itself, or just taking action or prohibition itself, is not enough to prevent or reduce the abuse of all these substances. So even me, I believe, even if we ban the use of tobacco in Nagaland, people will eventually find ways to get to that, to get all this stuff. Eventually, they'll lead to some illegal activity also. So personally, what I feel is like we have the knowledge, we know what these substances can do, we know what cancer is. So it's not a lack of knowledge or awareness which is stopping us, but it is our own inability. We do not have self-control, we do not have discipline. And then we are not able to stop that. So another reality with cancer is like, of course, we have come a long way in treating cancer. We are able to treat most cancers, but it's better not to get cancer because the treatment of cancer, again, is very taxing for the patient, for the family, financially, spiritually, mentally. So prevention is better. Actually, I will focus on the chewed tobacco a little bit. I'll stress on that because nowadays we see a lot of young people, even in their school, in their high school, who are getting into the habit of using the chewed tobacco. And then it's very easy. And then since the elders are also taking, since the parents are also taking, it's very difficult to stop them because the young ones will follow the elders. So we are at a point where if we don't do anything, then eventually in 10, 15 years, we are really going to face a huge problem. Our hospital, the hospitals in Nagaland, even outside, will overflow with cancer patients because all the abuse which we are doing now, the substance abuse we are doing now, will catch up to us. So this is an awareness as well as a request, and then we cannot kind of force you not to eat, but it's better that you don't meet me in the hospital. It's better you stay out, you stay healthy, and then consider this, like you are young now, but eventually you'll grow old. Eventually your strength will start failing you. Eventually you'll have a family, eventually you'll have kids. So you have to think for that. And then what you do now is going to decide your future. If you want to be healthy 20 years from now, if you want to be cancer-free 20 years from now, then take the action now. They say that to stop smoking or stop drinking, the best time was yesterday. The best time was yesterday, today is a good day. Tomorrow might be too late. If you are thinking like, I will enjoy this next few years and then I'll stop, it might be too late for you. Your friends, the people you know, they may not get cancer, but for you, you may not be that lucky. So it's time to take that step, to take control of your life, to say no to all these substances, which is not going to give you any benefit, which is not going to give you, make you win any gold medal or anything like that. It's only going to affect your life, it's going to affect your mental health, it's going to really make life difficult for you. So that is my short talk on substance abuse. Another thing which I would just add is to seek treatment, because cancer is quite prevalent in our society. So if you see a swelling somewhere, if you see blood in your spit or from your nose, or if there's blood in your stool, or if something is there and that is not improving over time, then it's better to seek treatment. Because what I would like to put out is cancer is curable. We have cured many patients. Many patients are now cancer-free. They are doing well. But you have to seek the treatment early. And then treatment is possible and there is hope. So that is my short thing. Thank you.